in it as much as we can. And I hereby declare this webinar open and look forward to a very constructive and informative webinar. Thank you very much.
Thank you very much, sir.
Maybe you should mute everybody apart from the... I want to appreciate Dr. Goodwill as well. Thank you very much. We finally got you here. We appreciate your attending to us. Thank you.
Please, can we all mute?
Some people don't have, that's why they know it.
So we
Jeez. It appears her connection is problematic. Head of service, sir, if you allow me, because it appears Mrs. Durodola's connection is a challenge. If I could just go right into it.
Has to unmute.
Oh. I'm sorry, I've been muted since. So
Yeah.
I said Dr. Ogugu obtained a basic medical education from College of Medicine, University of Ibadan, and residency training in internal medicine plus geriatrics fellowship from University of Pittsburgh Medical Center, Pittsburgh, Pennsylvania, USA. She is a pioneer geriatrician in Nigeria, contributing to the well-being of older adults through service provision as clinician, training of the healthcare workforce in West Africa sub-region as an educator, and advocacy and capacity building in aging issues as a member of steering committee of SGA Africa, an executive member of Geriatrics Association of Nigeria. She co-facilitated the first SGA Africa Conference in Aging, Abuja 2018, and the African Regional Conference on Human Rights of Older Persons in Africa, Abuja 2019. She has made great contributions as a member of Technical Working Group on Aging in Nigeria, involved in policy document review, hearings on bills regarding older persons, and stakeholders' engagement with relevant government ministries and agencies to promote age friendliness in Nigeria. She is currently the head of the geriatric unit at the National Hospital, Abuja, Nigeria. You have the floor, Dr. Ogugua Osiobu. You can go ahead with your presentation. Thank you very much.
Thank you, Mrs. Durodola. Yes, thank you very much. Good morning, everyone. Let me lean on the already established protocol. I pay special tribute to the head of service. I am delighted to be amongst you all this morning. And Mrs. Drodola, I'm glad that you finally caught up with this Dr. Siogu. I didn't realize you had been chasing me for that long. So it's really a pleasure to be here. Aging can be, well, let me start by saying aging is good news. The fact that people are living longer is good news because, you know, our lifespan used to be much shorter. Average lifespan in the country was in the 40s, but now we're up to 61 for the men and 63 for women. So that's good news. The downside of it, however, is that as people get older, there are risks for multiple medical conditions that we refer to as multi-morbidity. And where those conditions are not well managed, people can actually develop disabilities from them. And in some cases, premature death. But aging is a good thing. And I just want us to keep that in mind, because sometimes some of our older adults do not embrace aging just because of the challenges that come with it. Just see it as your new normal when you have aches here, aches there. And there are interventions to look after those aches. Okay. Trying to get this to move. Maybe I should have actually sent it to you as well. All right, while I'm trying to get this to move, I'll just tell you a story of an 83-year-old woman who has multi-morbidity, meaning she has hypertension, she has a high body mass index or obesity. Her body mass index is about 36. And she has multiple joint issues, the neck, the lower back, the knees, and all of those make it difficult for her to move. So navigating movement is a major problem. And she always seems to be complaining her children getting inundated with the fact that, you know, mommy is always complaining of her neck, her back, her knees. And she barely moves because every time she moves, something is aching. The other challenge is that she's had to relocate from her usual location where, you know, she at least has control now. She's living with her children in Abuja. That's also another challenge. I don't know why this won't move. I'm trying to get this. I'm going to stop sharing and try and share again, see if it will move when I do that. Sorry about that. Share again. Let's go to slideshow. Oh, thank God. Okay, using that background, tell you a little bit about aging and some of the physiological changes, and then go right into the degenerative. So I usually like to start this conversation with this simple question: when does aging begin? And I've been in, you know, presentations where 60-year-olds are saying, oh, it starts at 70. So aging really, I don't know if you want to put numbers on the chart. When do you think aging begins? If I just get 1 or 2 responses and then I can go right in. All right, I'm not getting any responses there. So we always used to think it, you know, began from birth. So once you're born, the aging process starts. But now with new evidence, we know that it actually starts from conception. So that environment in which a child, a fetus grows in, all that affects that fetus, affects how that person actually ages. So a mother who is an alcoholic has hypertension that is not controlled, diabetes that is not controlled, is in a violent environment, that fetus, as that child grows, does not age as well as one where all of those conditions do not exist. And we know that aging is a continuous, complex, and dynamic process, which eventually ends with death. But thank God people are definitely living longer now. And unless we die in our early years, each of us will grow old and experience the effects of the aging process. Okay, so this is the official record holder of the longest living individuals. But I've been talking to a lot of Nigerians recently who tell me about their grandmothers who are living up to the age of 130. So maybe we just don't have adequate, record keeping. But Jean Calment is still the record holder who lived up to 122. And the idea, what this tells me, is that we all have the capacity to live this long. These are some of the changes that occur as we're aging. To the left of this picture are those organs at a younger age. So healthy brain, the clear eye lens, so no cataract, healthy ear, and this individual can still hear without needing a hearing aid. Blood vessels are very clear, no clots forming, so no heart attack, no stroke, healthy lungs, healthy cells across the body. The joints and the bone and the muscles also really healthy, and strong immune system. So with aging, those changes occur, our immune system becomes weaker, so older people are much more at risk of getting infections, and when they get infections, also more at risk of succumbing. And we saw that with the COVID epidemic, where older people were the ones that were worst hit. And that one of the contributions to that is the weak immune system. As we age, our muscle bulk becomes thinner, or we lose muscle bulk, and that condition is called sarcopenia. If we all sort of look at our thigh, just stroke your thigh area, you feel an indentation, especially on the outer aspect, or what we call the lateral aspect, from the muscle bulk. The same thing with in your arms. If you raise your arms up, you can see some flabbiness there from the muscle bulk loss. And that we refer to as sarcopenia. That process starts from about the age of 30 and just worsens or progressively worsens with increasing age. But there are things we can do to make sarcopenia not advance or progress excessively. We also have a condition called osteoporosis, which is thinning of the bone mass. And what that does is that people who develop osteoporosis are at risk of having fractures, even with minimal impact. So they just hit the arm or the leg on something, and they can actually get a fracture right there. The other thing that happens in the bone muscle system is arthritis, really common, and that would actually be the major focus of our conversation today. Increasing thickness of the blood vessels, which worsens hypertension, which is why we have more hypertension in older people than younger ones, because the blood vessel becomes stiffened, and there's narrowing, which increases the risk for things like heart attacks and strokes. With increasing age, there are changes in the ears that increase the risk for hearing loss, something we describe as sensorineural hearing loss. And there are, again, interventions for that, which is why we say everybody should have access to healthcare. So whether you're 85 years old or you're a newborn baby, and there are things that are not quite right, we shouldn't always attribute everything to aging alone, and we describe that as ageism, where there is a bias towards older people because of their age. Mama is already 85 and she can't hear. Oh, well, yeah, she's entitled to not hear. But it might actually just be that Mama has wax in her ears. We take away the wax and her hearing is restored and her quality of life is better. But if she never had access to healthcare, we would never know, and she might die with that hearing impairment that never got intervened upon. Cataract is also something that we see very commonly with aging. Glaucoma is another very common one with increasing age, and the risk for glaucoma increases from the age of about 40. So everybody from about that age must get an annual check that includes looking in the eyes. Glaucoma is basically just increased pressure in the eyes, and having that pressure checked annually is very important. The other thing that happens with aging is we get loss of the brain cells, the neurons, and that increases the risk for the condition we call dementia, which again affects quality of life significantly. So I'm going to now go into the degenerative joint diseases. So osteoarthritis, which is the common umbrella name for these degenerative joint diseases, and they affect different parts of the body. Because when the cartilage, which protects the joint, loses its smooth appearance and has micro cracks, and there are a collection of debris builds up in that joint. It results from wear and tear, and it's related to frequent joint usage. So anyone who, for instance, I was an athlete as a child. So before I was even 40, I already developed changes, arthritic changes in my joints, because I did long jump, high jump, all of the things that you can think about. So there was, almost an excessive usage of my joints, and the wear and tear occurred a lot more earlier than it would for anyone who didn't engage in those activities that I did. And the prevalence of osteoarthritis is about 96%. This was from a study that was done here in Southwest Nigeria. And in order of incidents, there were more osteoarthritis affecting the knees, and then the lower back and the hips, the neck and the hands. And really, this is very similar to what we see even in my cohort of patients at the National Hospital. Osteoarthritis remains the most prevalent chronic joint disease and potentially incapacitating joint illness. From the story I gave you about the 83-year-old woman, she has this disability, it's already affecting her psychologically, and it's beginning to affect even her relationship with her children. So it really can bring about disability as well as impair quality of life, which is why it's important that we address it. So when we look at younger people compared to older people, many more above the age of 60, 65 have, develop osteoarthritis. So major risk factors include increasing age, obesity, when the joints have to carry much more weight than they need to, especially the knees and the hips tend to really cry when people are overweight or obese. Certain vocations that involve a lot of movement across the affected joint. So farmers who are bending and getting up, professional drivers, there's a lot of movement, especially of the neck. So such people, the drivers tend to have more neck and lower back arthritis. And if there've been previous injury to a joint, the risk of developing the age-related arthritis even increases more. Excuse me. So what are the consequences of these joint diseases? Impaired movement, impaired function across that joint, because what happens is with the pain, the muscles around the joint develop spasm and they become stiff. So there's a lot of pain, there's stiffness in the use of the affected joint. People develop deformities in some of those affected joints. And you must have seen people that you knew had straight knees who now in their older ages are now bowing or their knees are knocking, all from the arthritis of the knees. With all of these disabilities, there's an increased risk of falls, and we do not like falls in older people. The falls or the fractures, they stay in the hospital for much longer, develop pressure sores or bed sores, and the list goes on and on and on of complications that would increase further length of stay in the hospital. And you can imagine what will happen to the psyche of such an individual, risk of undue anxiety, depression, and all of that, in addition to the increased cost to the family. These are the common areas where we find this degenerative joint diseases: the neck, lumbar spine, which is the lower back, the hand, the knees, and then the hip and the foot. So this is what happens. To my left, to the left on the screen, is a healthy joint. You can see the cartilage. It's very nice, smooth. There's still adequate space there where you have the fluid, which is the synovial fluid, to cushion. So as the bones move to create movement across that joint, they have adequate cushioning from the synovial fluid. And we come over here, you see that the cartilage has been eroded, cracked in so many places, and the fluid in between is reduced significantly. You also see the changes with the joint capsule. These are all the things that bring about the pain that we see in osteoarthritis. So commonly, there's pain across the joint, there's stiffness. When we touch the joint, during examination, there's tenderness. When you're walking, and some will say, doctor, as I'm walking, I can hear the sound from my knees. Which we describe as the grating sensation. There can be swelling and the bony spots that we see when we do x-rays. So we do see deformities, the bowing of the knock knees. There's also muscle wasting. When the joint is so painful, some people just refuse to move. And when you don't move, you start wasting the muscle more. If you remember, I mentioned sarcopenia, which is a muscle bulk loss. So osteoarthritis even worsens sarcopenia. And that's what we call it a double jeopardy. You're already dealing with the pain. You're now also dealing with muscle bulk loss. And those two combined increase your risk of instability and fall. This just shows us the many main stages of osteoarthritis. Stage 0, there might be no pain at all. You can still do all that you do. Stage 1, very mild joint pain. And such an individual can also continue to do what they do. And really at this stage, some people, because they do not embrace what is beginning to happen to them, they quickly move on to the later stages when they stop moving and stop using that joint just because of mild pain. How do we cope with the joint diseases? Exercise, very important. We must exercise the muscles around the joints regularly. And there are very simple exercises. You just standing and lifting your leg backwards, flexing and extending, or lifting your legs sideways. Those help to build resilience of the muscles around those joints, reduce pain, and ensure that you actually can continue to use the joint. You have to keep moving. You must avoid prolonged sitting. The tendencies are, I have pain, so people just sit. But we have to really keep trying to cope with the pain. There are so many interventions, which I'm going to mention, that we can use so that you can continue to move. Movement is key. We say that every hour at the most, following sitting, you must get up and walk. We're all supposed to take about 150, do 150 minutes of walking every week. And that translates to about 30 minutes, minimum 5 times a week. The other target is 10,000 steps a day, and we can't achieve that if we're sitting. We have to keep moving. Ensure adequate posturing. The type of seat, the type of equipment that we sit on is really important. We all have beautiful sofa seats in our homes. Those do not help our back or the neck. We must have chairs that are a little higher to sit on, that will give back support and neck support to ensure that those areas are not as painful as they would if we use sitting equipment that are not appropriate. We must make sure that we ensure proper footwear and even the apparel for walking and exercise to reduce the risk of falling. I see some people are walking wearing open toe slippers. No, it must be the appropriate footwear. And weight management, ensuring that our body mass index is actually within the normal range of 19 to 25. For a lot of older people, especially those 70 and above, we allow up to 27 BMI. But really, if you're overweight and you have painful joints, very important that the weight is managed. So in geriatrics, because of the risk of adverse effects from use of medications, we tend to do what we describe as non-pharmacological interventions, meaning non-medication intervention. So we use warm or cold compresses for painful joints. So a hot water bottle will be a good thing to have in every home. Put in the hot water in the bottle, wrap it around, and some of them already come wrapped with what looks like a towel, and put it on a painful joint for about 3 to 5 minutes. You can do that multiple times a day. It's just to be sure that there is no spillage of the hot water to cause a burn. There are some who like cold on their skin, so instead of the hot water bottle, you can use ice, wrap it in a towel, the same thing, put it over the joint, 3 to 5 minutes, multiple times a day to reduce pain. There are topical medications that we use, like diclofenac gel, salicylic acid gel, that also help with pain control, that can be applied twice a day. We also recommend the use of braces to stabilize joints, especially the knees. And there's also a lumbar corset that we also use to stabilize the lower back joints, again, so that people can continue to move. When there's increasing difficulty, even while moving without support, we have walking aids that we also recommend. Some of our older people are not very keen to use walking aids because they feel it signals that they are old, but really we recommend that when you need it so that you do not fall. So walking, the sticks or walking frame, and I think I have a slide that shows all of those aids, and making sure that we adapt the home to prevent falls. There are specialists called occupational therapists who can come into the home and adapt the home to suit the situation of any older adult to ensure that they do not fall. So grab rails, so as you're walking along your corridor, grab rails in the toilets, high toilet seats, bath chairs, so that one is not squatting and falling in the bathroom. So actually having a chair that you can sit on, just so that you're comfortable while taking your bath and no risk of falling. These are some of the things that we can do to also reduce the flare of arthritis. Make sure you use the interventions that will reduce pain. Don't sit for prolonged periods of time. It's okay to say, I have done enough for today, and tomorrow is another day. Being able to do activities that help you. Swimming is a good one for those of us who like the water and can swim. It's actually really good for relieving pain across joints. Yoga, and some of the other interventions that have been found to actually have with controlling pain. So this, I had mentioned this. These are some of the things we can use to stabilize the joint so that we can continue to move. Right here is showing the appropriate way of sitting. back support all the way, and the back is straight, versus this other individual that's bent over. You can see the strain on the neck, strain on the lower back, strain on the knee joint as well. These are examples of some of the walking aids that one can use. In addition to all the things I had mentioned earlier, there are also other interventions. So some of my clients who have significant joint issues, and we've used some of the other interventions and they have not had relief, we refer them to the orthopedic surgeons who are able to give injections into the knees. And when that doesn't help, further escalates to joint replacements, and these are readily available in the country right now. There are also those who require surgery for the spine, either in the neck or the lumbar spine, for very severe disabling disease. What some of the complications that we see in our clients is they use pain medications for a long time. A number of these pain medications that we describe as non-steroidals, diclofenac, ibuprofen, are not medications that you use long-term. You use them in short bursts, 5 days, maybe maximum 2 weeks, and you get a break because of the risk of bleeding from the stomach, the risk of increasing high blood pressure, worsening blood pressure control, the risk of kidney disease. So these are not medications that we just go to the pharmacy and pick up. Very important that every one of us, and I hope everyone on this call, has an identified clinician or general practitioner that they go to that has their history. Because when something is wrong with us in the body, the first port of call is not the pharmacy or the chemist. It is the doctor's office. The doctor takes a good listen, examines you, identifies, comes up with a diagnosis, and then says, oh, we need to do this test, or we need to give you this medication. So I urge all of us, because of the risk of adverse effects in older people, please make sure you identified a doctor that sees you on a routine basis. Next, I'm going to talk briefly about diabetes, because that's also one of the common things that we see in older people. I see Pastor Sunday has his hand up. If you just give me a few minutes, I'm rounding up. So for diabetes prevention, there's a study done in the US that followed over 200,000 people. And these were the things that they came up with as, and helping to prevent diabetes. Maintaining normal body weight as we're aging, making sure that we engage in moderate sweat-inducing exercise for at least 30 minutes, 3 to 5 times a week, not smoking, maintaining healthy diet that is high in fiber, in proteins, and very low consumption of fats and carbohydrates, and little or no alcohol drinking. So what are the symptoms that will make us think we might have diabetes? Frequent urination, sudden weight loss, you have wounds that don't heal, vision is blurry, there's reduced libido, erection is also reduced. This person is eating a lot, but always feeling hungry. And then despite eating a significant amount, they are also losing weight. And for women, there might be evidence for vaginal infections. There might be some tingling in the feet and the hands. So when people have any of this, you must really make sure that you check yourself out for diabetes. And why are we concerned about diabetes? Is one of those conditions that increases the risk for stroke, risk for heart attack, risk for kidney failure that people are requiring dialysis for, and ultimately kidney transplant. So we want exercise is key, the major medicine for living long without disability. Now, slight mention on hypertension. Again, one of the commonest things that we tend to find, common conditions that we tend to find in older people. We looked at our cohort at the National Hospital, and we found a prevalence of about 88.8%. It's responsible for more than half of first-time acute strokes in Africa, and it is highly modifiable. So hypertension can be prevented. Maintaining the same things about preventing diabetes, maintaining an optimal BMI, exercising regularly, no smoking, drinking alcohol in moderation, really important. It's also a known risk factor for dementia, because there are 4 different types of dementia, and one of them, the vascular dementia, been linked to hypertension. So we really are concerned about this, and with increasing age, we're seeing more issues of hypertension. And unfortunately, we're not managing the blood pressure. We're not having good blood pressure control for multiple reasons. People don't keep coming back to their doctors. There's doctor shopping. You go to Dr. A today, the next time is Dr. B. All that doesn't help. If blood pressure control is one of those that we have multiple medications for. So if one particular medication that was given to you is, you're not tolerating it well, please go back to the doctor and complain about it, so you can be given something else, rather than stay away and go to a different doctor. Really important, this issue of it is not my portion. When somebody is told, oh, madam, you have high blood pressure, it's not my portion. Really, it is not anybody's portion, but you must face it. If your blood pressure has been found to be elevated, please take your medications, do all of the lifestyle changes so that the blood pressure is controlled and the risk of stroke does not occur. Stroke is the leading cause of death worldwide. It causes disability. 70% of the cases occur in low, medium income countries like in Nigeria. And we did a study in a hospital where we found a stroke prevalence of 1.14 per 1,000, but the 30-day case fertility rate was as high as 40%, meaning 4 out of 10 risk of dying within 30 days. And most of the cases of stroke are ischemic. We tend to find more strokes in men, in the Black race, more than the Caucasian race or Hispanic race. And increasing age, of course, above the age of 60 is a very big risk factor. So blood pressure over 120/80, being a smoker, being overweight, having diabetes, having high cholesterol, which is another condition that everyone must know their numbers for. What's your cholesterol level? Having heart disease, age above 60, all of those are risk factors for stroke. I would want everyone on this call to be able to identify a stroke when anyone around you is, excuse me, is developing a stroke right before you. So just knowing this mnemonic, FAST, F for facial drooping, the face of the person suddenly gets contorted, where it shifts to one side. One side of it is flat and the other still has the wrinkles. You ask such an individual to raise their arms and you find that one arm doesn't go as high as the other. The weaker arm doesn't go as high as the stronger one. You ask the person to say their name and the speech is distorted. T is for you to hurry to get to the hospital because time equals brain cells. So we all must be able to identify a stroke. And once we see anyone around us with any of these features, we need to get them to the hospital ASAP. And how do we prevent? Managing those modifiable risk factors, high blood pressure, diabetes, obesity, smoking, dyslipidemia is the high cholesterol, and substance abuse. We're seeing strokes in younger people who are using substances like cocaine, and then ensuring a healthy lifestyle. So these are the 6 pillars of healthy lifestyle. And we also translate them to the 6 pillars of healthy aging. So restorative sleep, minimum 8 hours a night, meaningful social connection. So I expect that this group is maintained not just for the webinars, But for other things, do you do retreats? Do you go on trips? You know, and 4, 5, 10 of you form, very meaningful groups. You have you share the same value. You make yourselves feel relevant. You enjoy a lot of laughter when you're together. So many studies have shown that social connections are very important for aging well. We should eat more plant-based foods that are whole grains. I want us all to look into, there's parts of the world that are called the blue zones, and they are said to be areas where people forget to die because their life expectancy is, beyond 90. And their lifestyle has been studied, and they found out that they do a lot of walking. They eat more plant-based foods, very minimal meat in their diet. They often tend to connect. There's a lot of intergenerational connection between the young and the old in those blue zones. And they also pace themselves so they avoid undue stress. One of the other things to avoid for healthy lifestyle is excessive caffeine use and excessive alcohol use, and of course, avoidance of substance abuse. So nutritional care is very important, that we take reduced calories from fats, increased calories from fruits and vegetables. Simple sugars, salt, and fats have actually had a lot of attention in recent times as the nutrients of concern in the public health space. So we must avoid simple sugars, avoid trans fats, and avoid excessive salt. Once you can taste salt in your food, then it's excessive. Salt is supposed to be an enhancer for the natural taste of food. We're not supposed to taste the salt in the food. Physical activity, I already talked about that. Healthy life promoting choices, avoidance of the toxins, I already mentioned that. Make sure you're avoiding over-the-counter medications. Go to the doctors for any state of unwell, any illness, so that you have an appropriate diagnosis made. Prevention and early detection of diseases. We all must know our numbers, your blood sugar, blood pressure, cholesterol, PSA for our men from the age of 40. Everybody must know their BMI, and you're tracking these numbers from year to year. It's important that we all do the age and gender appropriate screening for disease conditions. So colonoscopy at the age of 45, we used to say 50, but we're now finding that younger people are getting colon cancer. So it is now recommended that we get colonoscopy at 45. And if it's clean, you don't need to do it again for another 10 years. PSA test for the men, pap smear and mammography for women, immunization for vaccine preventable diseases, so hepatitis B vaccine, I hope we've all had that, the COVID vaccine, pneumonia vaccine for all our older people above the age of 65, and the influenza vaccine as well. Good personal hygiene practices. Dental care is one that I realized that it's rarely talked about, and it really should be part of the full medical check. Every year, we all need to go in for dental care. And every 6 months, we're all supposed to get a scaling and polishing to keep the mouth clean, because the mouth can be the entry point for bacteria into our body. Skin care, as we're getting older, the skin becomes really dry. So it's important that we add emollient. The dryness of the skin can sometimes cause itching, and I've seen older people that are being given Piriton to stop itching when the treatment really is to put, good slap of Ori or Vaseline or on the skin to stop the itching, and voila, you don't need any Piriton. Social connectedness, spirituality, I already talked about that. So in summary, we're living longer. In Nigeria now, our last National Bureau of Statistics Living Standards Survey gave us a figure of about 14.8 million, so almost 15 million people in Nigeria over the age of 60 years. The risk of disease burden increases with age, but really increasing aging population is good news for the world. Osteoarthritis is a common chronic joint disease with risk of disability, falls, and poor mental health. state. So it's important that we actually can identify it and manage it. And the risk factors that I had mentioned earlier, routine movement, exercise, all improve the symptoms and build muscle bulk and delay sarcopenia. Very important that we identify these common non-communicable diseases, hypertension, diabetes, and live healthy lifestyles to reduce the occurrences of this. So in the end, it's not the years in us that count, it's the life in the years. So in geriatric practice, we want to put life in the longevity that we're expecting in the world, and particularly in our country. So while we're enduring pain, we should not let that become a way of life. Take action today to manage your symptoms and slow further joint damage. With the mix of the lifestyle changes and pain relief treatments, you can lead a healthy and active life. Thank you very much for listening.
Wow.
Over to you, Mrs. Dodola.
Wow, thank you very much, ma'am. That was very, very loaded, informative, very, very instructive. Thank you very much. I hope we got our notes because this is very, very, very loaded. We are live on YouTube, and it will always be there on YouTube, so we can go back there and watch over and over again, because I'm sure if we are getting notes, we may not be able to get all the points, just like I didn't get all the points too, but at least I was able to get some. You know, she mentioned almost all the diseases that affects the elderly. You know, sarcopenia, loss of muscle mass. She mentioned dementia. She mentioned osteoporosis, osteoarthritis, diabetes, hypertension. And she did mention that we can effectively manage these things if we learn to live a healthy lifestyle. She mentioned 6 pillars of healthy lifestyle. She said 8 hours of sleep. She mentioned social interaction. I think she also mentioned that we should eat more plant-based food, green. She mentioned physical activities, routine medical checkups, that we should know our numbers. You know, when we do all our tests, we should know what's my BP, what's my cholesterol level, things like that. We should know. Well, I know we have questions, so let's give room for question and answers. I can also see there are some questions on the chat already. Let's look at some of them. Okay, somebody said, please, what causes pain in the arm joint, shoulder down to the elbow, and how can it be managed or reduced? That's a question. You can answer that, ma.
Okay. Right. So very likely.
You even want to look through the chat and take some of the questions before we now allow people to verbally ask questions or even to type.
Okay. All right. So the pain in the shoulder, the shoulder is also one of the joints that can be affected by osteoarthritis. And when the joint is painful, that can be referred, what we describe as referred pain. Sometimes pain in the neck is referred to the chest, and some people actually think they're having a heart attack, or referred to the back. So you can have referral of pain from the affected joint, tracking down to the muscles that are, you know, every joint has a muscle insertion. So the muscles that are inserted across in that joint, you can get the pain referred along that muscle. So you can get pain from the shoulder tracking down to your arm. So while this is a informative session, it's really not meant for me to give therapeutic counseling at this point. That's why I've said everybody must have a doctor. So please make sure there's a doctor who sees and examines that shoulder and the arm to ensure, because sometimes it could be arthritis, it could also be a torn ligament, it could be collection of fluid, what we call a bursitis. So that's why it's important that you don't get curbside consultation. You really must have a doctor take a good look at you to be able to come up with the appropriate diagnosis of what might be happening. Someone, I think I saw a question about, does drinking ice water affect the joint? So there are, I've consistently seen, you know, my patients come who say, oh, in the cold season, their joint stiffness and pain worsens. And because of that, some of them actually would just prefer not to take anything cold because it might lead to a flare of the arthritis. So this is what I'll say. Our body really talks to us. I have maintained a body mass or a body size or clothes size of 8 for many, many decades. And why have I done that? Because I mentioned to you earlier, I developed arthritis at a very young age. And once my weight increases even a little bit, 1 to 2 kg, my knees cry a lot more. So that is a way of me checking. So because I'm listening, I am able to put a check on, you know, on my weight and make sure that my knees don't have more weight to carry than they need. So the same way, if you're exposed to cold and you're feeling a lot more pain in your knees, or when you drink your cold water. So there are ways that we all individually can manage this by just paying attention, just listening to what the body is telling us. Somebody put here, what's the cause of pain in groin? That can be different things. Hernia, it could be arthritis from the hip. We have to just look at all the different structures in the groin area. It could be coming from the vessel. So again, I cannot overemphasize the need for us to always go into a doctor's office whenever something is amiss in our body. And let me also say this. I hear people talk about, oh, normal cough, normal headache. There's nothing normal about cough and headache. If you have a headache, there must be something causing it. If you have a cough, there must be something causing it. A headache that you sit on for months could end up being a brain tumor. So we might, especially in our older adult age groups, increasing age is a big risk factor for cancers. So if something is amiss, please go into the doctor's office. Make sure you have a doctor who you respect and you have value for, and let them take a good look at you and make sure that if there's anything to be discovered, it is discovered early. There's a saying that women live longer but with a lot of pains. Is this true? Can this be related to hormonal differences between women? So there is something we describe as the femininity of aging. When we look at all 85 plus, we tend to find more women in that cohort than men. So yes, we're finding globally that women are living longer. It's not certain what is responsible for that, but some of that have been put forward, the increasing cardiovascular risk burden for men. So men tend to have more heart attacks, more strokes. So, you know, do they prematurely die before 80, 85 from those cardiovascular diseases? The other thing is the nature of men to, you know, want to engage in in quotes, more daring and sometimes reckless activities that also could lead them to early deaths. So the hormonal differences protect the women. So our estrogen that takes us on up until the age of menopause protects women from those cardiovascular diseases. So it's only after menopause that the risk of cardiovascular diseases start increasing in women. And I guess before they catch up, some of the men might already have succumb to those cardiovascular diseases if they were not managed on time. I would like to know the cause and remedy of severe pain in the foot, especially in the morning. Okay, so pain in the foot could be coming from, we have a lot of joints, very tiny, tiny bones in the foot. So multiple joints in the foot. It could also be coming from arthritis. But we also have something we call calcaneal spur, which is just a bony outgrowth, particularly in the back of the foot. You step your foot down and it's really painful. But after a few minutes of walking, that pain actually eases. Again, you really need to go and make sure that you get this checked out so you can confirm whether is it just calcaneal spur, is it arthritis in some of the small joints. There's a question that quickly went by now, something about what should we be looking at? Let me see if I can get that. To know the cause and remedy of it. Okay, already. When a person has mild headache going to a week, what could be the cause and what can be done? So headaches can come from anything, any structure around the head, eyes, ears, teeth, the brain, the throat, the things we have on the face that we call sinuses could be coming from the sinus. So it could be any of that. So it could be something that is localized to the head or something systemic. We know that when people have infections like malaria, they also get a headache. We also know that in some very fortunate people, because a lot of people with high blood pressure get no symptoms at all, but some are fortunate to actually get a headache when the blood pressure goes up. It could be a side effect of a drug. There's some of the drugs that we use for blood pressure that actually can also give headache. So multiple things. You really need to go into the doctor's office and have a conversation around what might be responsible for it, for the headache. How do we take care of painful sore? I think I already mentioned that it could be from a calcaneal spore. And wearing appropriate footwear. So shoes that are softer or have softer insole. And in fact, you can actually now buy insoles for your shoes to make so that when you put your shoes on and you have the insoles in there, there's a lot, it gives you a lot more cushion and it's more comfortable when you walk. Okay, I think I've gone through all the questions on the chat.
Okay. Thank you very much, ma. I think but Mr. Fariogun was actually signifying. I don't know whether his question has been taken. Mr. Fariogun, if you still want to ask your question, please, you can unmute and let's hear it. Pastor Gabriel Afariogun. If you are still there, okay, you're still there. Please unmute. Mr. Afariogun. Okay, maybe his question was answered. I think we've taken all the questions. Thank you once again. I don't know if anyone has any comment.
Madam.
Okay. Okay, Pastor Fariogun, you can go ahead with your question now.
My question has been answered.
Okay, all right. Okay, all right. So thank you very much. Okay, I don't know if we have any comments. Somebody wants to say something before we invite the head of service for his comments. Okay, I think Dr. Oduwale is here. Okay.
Hello.
Yes.
Mrs. Dudala.
Yes, please.
I sent a message on the chat. Can you please read it out?
Okay. Appreciate all these clinical insights to our health as elderly. But that brings this question directly to the HOS, Mr. Guru, on what is really on for the retirees in healthcare registration. So far, nothing heard from Lashma or pension on it.
Thank you.
All right.
Yeah.
Okay, the head of service will speak to that when he's going to make his own comment. I'm sure he's hearing us. He will speak to that when he wants to make his own comment. So, Mr.
Thank
Legali.
you.
Thank you
Mr.
very
Legali.
much.
Okay.
Thank you, ma'am. First of all, I want to appreciate the facilitator. He had really dealt with burning issues concerning our health, and kudos to her. Thank you very much. God will continue to increase her in wisdom. And what I really want to talk about, she mentioned that aspect, the pain in the feet. Some of us, when we are doing workout, after about 10 minutes, that is when the pain starts. The question now is it the same with the normal pain in the feet? Without the exercise, no pain. But after 10, 15 minutes of workout, then the pain will start. This, she needs to at least clarify the issue, whether it's the same thing or it's a different ballgame. Thank you very much.
All right, so one is, are you wearing the appropriate workout shoes? Remember I mentioned that earlier. Secondly, blood flow to the legs. It's important. If it's impaired, and sometimes we see that in people who have diabetes, people who are smokers, people who have high cholesterol, where the blood vessel taking blood to the legs is actually narrowed. And when you're at rest, there's no pain because blood supply at rest is fine. But once you start exercising, the muscles need more glucose, and for the muscles to get the glucose, the blood flow needs to be adequate to the muscles. And if in the background of reduced caliber of the blood vessel, with exercise, such individuals can have pain in the leg, something we call claudication. So that, again, you need to have, and there are ways we can examine your blood vessels to check if you have that by doing a Doppler ultrasound. And so it will be important to check that out to make sure that it has nothing to do with the caliber of your blood vessels, taking blood to your legs.
Thank you very much.
You're welcome, sir.
All right. So let's take the final one. Pastor Afariogun, you are still there. You have another question?
Hello.
I think somebody said her question had not been answered. Florence Ampon.
This is Rodala.
Yes, ma. Okay. That's okay. That's thank you very much for joining, ma. That's the former honorable commissioner in the state.
You're very welcome, ma.
All right. What's your question, ma?
I asked a question that what are the things to look out when one is experiencing weight loss?
Okay.
Okay. That's a very good question, ma, particularly with increasing age. So diabetes is one of them, which is also one of the symptoms of diabetes. You're increasingly hungry, eating more, but you're losing weight. You have to think about diabetes. And in addition, you might be peeing a lot. So you think about diabetes. The other thing that could cause weight loss is thyroid disease. disorder, something we call hyperthyroidism. So we all have the thyroid gland in the neck, and I think some people need to mute me. All right, so the thyroid, when it's producing hormones in excess, will lead to things like excessive sweating and significant weight loss. So people might actually see you and think you might have something like HIV. So thyroid disease is another thing to look out for when you're losing weight that you have not planned for. The third is cancers. One of the symptoms or signs of cancer in the body is weight loss. So these three things, really important: diabetes, thyroid disease, and cancer. And it means you need to go into the doctor's office and actually have a good check.
Okay.
All right.
Thank you very much, Ma. I would like to call on Dr. Oduwole. Let's have your take. And please appreciate the facilitator on our behalf, Dr. Oduwole.
Thank you very much.
She actually introduced the facilitator to us. So thank you very much for that.
Dr. Osi Ogbu is a renowned consultant geriatrician that I have always been following. There was a lecture she gave on dementia in the older adults, and it has been on my head since. And apart from that, we belong to the same Medical Women's Association. And she's a member of the International Medical Women's Association. We're on the same committee as well. But I want to really thank you for this. And to have her on has taken us about 3 years to show how busy her schedule is at the National Hospital Abuja, in Abuja. So I want to thank you for this insightful and impactful lecture. And I wish you the very, very best in everything that you do. Thank you for coming.
Thank you so much.
Thank you. I hope you'll still come back, especially to give us that lecture on dementia.
Yes. It will be my pleasure. I really feel so honored and privileged to have been amongst you today. I see about 90-something people on the call. I'm really honored and humbled. And I hope that I've been able to enrich you one way or the other with some information, and that you can also carry this on to other people as advocates, so that as Nigerians are living longer, they actually remain healthier.
Thank you very much. And I want to thank the former head of service and the present head of service for this. And to Mrs. Rudola, thank you for this. Thank you so much. Thank you, and God bless everybody.
Thank you very much, Ma. So once again, I want to say thank you to our facilitator. We really appreciate you. And just like Dr. Oduwole mentioned, we would like you to still come back. We actually appreciated that this year you are the one that reached out, even though we've been trying.
Yes,
shows that
I was feeling guilty.
It was just because of your schedule. We really appreciate you for coming. God bless you. So on that note,
thank you so much.
I would like to invite the head of service, Mr. Abode Agboro, for his final comment, and then for declaring the webinar closed. The head of service.
Thank you very much. On this note, thank you very much. On this note, I want to yield the floor to the former and retired head of service, Prince Adolfo for him to do the honors for you. Thank you.
Thank you very much, sir. Oh. I think he left too. He's no longer on the call. He's no longer on the call, sir.
He's not on the call. Okay.
He's no longer on the call, sir.
Apologies, there's a lot of background noise because I'm actually at the climate change summit as well. So I'm doing two things at once. Thank you very much, everybody, for your participation. I thank the presenter very much for her expertise and detailed response to the questions. On the issue of last March, I think the PS last March will be in a better position than me to elucidate on the activities of last March. So what we will do is we'll get her to do a write-up that will circulate to this group so that everybody is aware. I don't want to give you incomplete information as I am not an expert in plasma activity. So the expert being the PS Zamba should do a write-up that will circulate. So on this note, I want to say thank you very much to everybody, and we'll see you next time. I acknowledge everybody and the retired Palm Secretary present. Thank you.
Thank you very much, sir. God bless you. So once again, I want to say thank you to everyone on this call. Thank you for joining. God bless you. So in another 2 weeks, we are going to have another session speaking about our finances and business. So we can all unmute now like we usually do. Let's say hello to someone that we've not seen in a while. Let's interact as we always do. You know, the facilitator mentioned social connection as one of the 6 pillars of healthy lifestyle.
One can never stumble.
Videos. Let's see
Thank
each other.
you, lecturer. Thank you, everybody.
One can never stumble. Yes.
Thank you very much.
One can never stumble.
Thank you very much. Dr. Duwale, good to see you here.
Thank you.
I'm still going to the question. We are still going to answer that question on behalf of us all of us.
Thank you so much.
Elderly judge, especially the directors.
Thank you, sir.
Regards to everybody.
Thanks to everybody.
Coming to you. We have to talk on it. God bless.
Thank you for being with us throughout the course, sir.
HOS, sir, Mr. Ajibade, Mr. Bukola, and everybody, I say good morning.
You're welcome. Thank you very much. Thank you, man. Long time no see. How are you?
Oh, Mrs. Odeneye. Good to see you.
Good morning. Thank you for being there for us.
Thank God, ma.
Thank you, everyone.
Thank you, ma. Thank you for the webinar.
We thank God. Yeah. So I'm ending the meeting now until the next 2 weeks.
Just sharing our time till then.
Thank you.
See you. Bye. Bye.